Hello everyone, I'm Dr. Preeti Poghe and today we are going to talk about some tips of breaking of bad news station. This is going to be one of the difficult stations because unless you have rehearsed it or you don't know how the patient is going to react, right? So this can turn out to be a different station later on also. So you need to be very particular about this station, and remember this mnemonic. It almost helps in all the breaking of bad news stations. That is A, B, C, D, E. Okay, so A stands for advanced preparation. You need to have advanced preparation in your mind. That means rehearsing in your mind about what are the phrases that are important in this station. Also, you need to understand how you're going to take this patient ahead in the station, because then you need to remember the treatment. You also need to remember if the patient is going to react in a different way, how you're going to handle the patient. So everything should be in your mind first of all in these 2 minutes of preparation, right? Then B stands for building up of therapeutic environment. That means you need to ask the patient whether the patient wants someone to be there with them for support, or because what happens is when you give them idea that do you want to listen to this yourself, or you want somebody else to come with them, so in that way what happens is the patient already has an idea. That is actually you're giving a warning shot. So you're building up the therapeutic environment, right? So patient knows that there is going to be a serious conversation thereafter. Then C stands for communicating well. Of course, you need to communicate well with your patient. You need to be ready for whatever reactions the patient is going to give. So first, you need to ask the patient rather than tell the patient, right? So you need to ask the patient what the patient already knows. Most of the times, patients already know about their condition, and it might turn out to be a different station later on. So you first of all ask the patient what the patient already knows, and later on build up your own station on that knowledge that the patient has, right? And then of course you need to communicate well. You have to start giving warning shots. You need to tell that I'm sorry, I don't have good news for you, and then build up your theory slowly. Then you also have to remember that the patient is going to react in a certain way. So you need to give time for silence. You need to give time for the patient to gel in, right? The patient might be angry, crying, anything. So you need to stop even if your time is going. Okay. So D is, remember that whenever you're going to take the patient ahead, like in the station, after the reaction, you need to start drawing diagrams and tell the patient. Or when you're explaining the patient what the bad news is, you need to start drawing the diagram so that the patient understands whatever you're saying. Because the patient might be scared, might be in shock, so you might not remember everything that you're saying.